Another way this came up with, just a recent study that came out of Penn that I was part of, this even shows up, the negative thinking shows up on social media. So this is a group at Penn, and they asked me to consult on this study. They've gone into Twitter posts, and these are public posts, so people put them out there, and this group is able to get posting, and they're able to, thus far, accurately identify depression and anxiety based on Twitter posts. So they brought me in looking at adults with ADHD. So what are people with ADHD talking about, and how does that compare with people without ADHD? And ADHD is identified if the person has some statement that I was diagnosed with ADHD or somewhere self-identifies. So without going into all the nitty-gritty details, the ADHD group tended to use more conditional or hedging language, seemed to be more uncertain about things. Maybe if I do this, this will happen, but maybe not, I'm not sure. More anxiety and anger emotions in the posts. Themes of lack of focus, self-regulation difficulties, intention failures. I tried this, but it didn't work out. Lower self-efficacy. More likely to post about past things rather than the future, and more references to drugs, from prescription to illicit drugs. So even on Twitter posts, we see some of these themes coming up. So, taking all this background, what's the relevant for students and teachers and parents? Well, the thing about students, it's a very dynamic developmental period. There's a lot of changes and developing mindsets, and you're trying a bunch of different things. So there's really a lot of threat out there in a way. You're going to be doing things that you maybe haven't tried before, be it athletics, academics, a new level of mathematics. One of the thoughts, and this isn't a hard, fast rule, but Russ Barkley's talked about this before, the 30% rule, that take the chronological age and reduce it by 30%, and that's your executive functioning age. Just as a reference point for, expectations and what the student might be dealing with. Like I said, facing new challenges, there are many boring tasks. School, getting your book back, getting things for practice. Even if you really enjoy your sport practice, keeping track of your shoes, your bag, whatever you need. And there are many compelling distractions. And the difficulties can get in the way of positive strengths, skills, and whatnot. And I always like the phrase, there's nothing wrong that cannot be improved with what is right. This was a retrospective study of adults with ADHD, but I'll go through these next few slides relatively quickly. But even in adulthood, they recognized having fewer positive experiences in their childhood and teen years. Now, there's a lot of variation here. Not everybody without ADHD had this pristine, happy, perfect life, and not everybody with ADHD necessarily had all of these things, but there seem to be trends of all these with differences. And even the mindset from childhood and teen years. Less likely to endorse that childhood experiences prepare me for adult life, that I had worse experiences than my peers, there are memories that still bother me today, a host of lingering frustrations from predominantly school, but it can also be social and other domains. And then it also affects the current mindset. Self-acceptance, outlook on the future, just having negative feelings at times. This is a study, and again, just briefly, it looked at personality and adults with ADHD, and they found it sort of spread into two different clusters or groupings. One was a group with a more negative outlook, little sense of control over what happened to them. They seemed to be less assertive, more complaining about circumstances, And then there was a group with a more positive outlook that seemed to be a little more resilient, assertive, balancing self with other. And being a clinician, I couldn't help but think that we couldn't help the group with the negative thinking, presumably with some negative experiences, to change their outlook, change their behaviors, to get to a more adaptive mindset. Even among college students, compared with those with learning differences, both groups tended to have lower motivation for academic work. It makes sense. If this tends to be more hard than it is for other students, you want the education, you want the degree, but it's more difficult to follow through. More anxiety, it's threatening, it's stressful. And when it came down to using strategies, though, the group with learning differences without ADHD were better able to implement the resources and seek them out and make use of them than the ADHD group. Again, getting back to the implementation problem. There may be supports, but now in addition to classes, there's one more appointment, or one more set of coping skills or therapeutic homework that you have to do. So again, how the organization gets in the way of the support. And even high school students looking ahead to careers have more pessimistic outlooks on what their career options may be. So even looking ahead, not even in the workplace yet, the past experiences increase the likelihood of starting with a more pessimistic outlook. So how do we bring this into the classroom, into the home? Well, let's take a look at what the adults, the parents and teachers, what are the cognitions we bring to the table? Yeah, I could add therapists in there too. What are our expectancies for child behavior? What should children at this age or teens at this age do? And I'm sure when we were all children and adolescents, we went to our parents and said, "You don't understand what it's like for me now. You never had to do this." When in fact they did, but now we're looking at our children saying, "Well, when I was a boy." Come on. How do you perceive what the student does? What are you actually seeing? Now, sometimes this can be what we hear from adults with the predominantly inattentive type. They'll say, "I was staring at my book and everybody thought I was reading it. But if you look close, I didn't turn a page because my mind was elsewhere." But also we can read into behaviors that we are seeing. And not only what are we seeing, what are our attributions? How do you interpret the meaning of what they did? And then also, what's your sense of self-efficacy as in the parenting or teaching role? Do you feel you can be helpful for your student or your child? So going through a couple of these slides quickly, improving parental self-efficacy increases follow-through on behavioral management plans, decreases dropout, and even parents who drop out, they view the behavioral strategies which have good evidence support as not being useful, and they say, well, we're doing well enough, even though there's obviously a lot of conflict. But when you have a more reasonable attitude, yeah, coping is up and down, it's hard to do these things, that realistic mindset helps persevere and get the most out of it. And there can be a lot of extreme, like perfectionistic thoughts by parents and teachers, especially about teens. They should behave, listen well, all these things. Homework should be done right away, first thing when they walk in. Driving, they should follow the rules all the time. But also, teens have distorted thoughts. Rules are unfair, they don't understand me. Chores are silly, I have to do everything. I work harder than my parents. Autonomy. I'm old enough to do fill in the blank. They should let me. So if you think you can do a thing or think you can't do a thing, you're right. So what do we do about this? Some of the exercises. Starting with the teen conflict, educating about the beliefs and the negative communication cycle. Empathy for the other. How would you feel if you put yourself in your parents' shoes, or if you put yourself in your teen's shoes? How do you want to be in this situation, and how can we make that happen? Sometimes proposing an extreme thought. So you're saying your parents should give you the new iPhone, a car, and should let you go out with any friend anytime you want. Apart from some of these sorts of interventions, there's also the general breaking the negativity cycle. Positive time between the parents and teens. Not when you're on a point system or anything like that, just doing things where you're not reinforcing or just hanging out, doing stuff that the teen enjoys that you enjoy doing with your parent. And using incentives. Incentives more than punishments, and good communication. Quickly, and we're wrapping up here. Decreasing negative communication. Oh, 10 minutes, I'm sorry. So we're not going as fast as I thought we were going to. So I'll go back just to make sure. Again, I was going to go to the, when it comes to parents and teachers, looking for opportunities to praise, the positive before the negative. And it's also a different mindset because, you know, parents were worried about our children, teachers were worried about our students, we want them to do well. But even the mental exercise of let me catch them doing something well and pointing it out specifically, even that mindset of what we're looking for affects how we see things. I wish I had the video of it. I don't know if anybody is familiar with, I think it's called the White Gorilla video. It's about selective attention. There are basketball players, I think in different colored shirts, white and red, maybe, I forget what. And they start passing the ball. And if you're watching the video, you're asked, count how many passes the team in the white shirts make. So they're passing the ball. Then at the end of the video, you're asked, did you see the white gorilla? White gorilla. When you go back and look at it, there's somebody wearing a gorilla suit, walks through the players, waves to the camera, and walks off screen. You're so intent on looking at and counting the passes, and part of this is an adaptive skill. You screen out everything else. But in that case, you know, because you're directed to look at it, it's not adaptive because you miss the gorilla. So it's just how we can get into our blinders in what we're seeing, because if we're trying so hard, and boy, as a therapist, I'm helping people try to reduce some of the difficulties, but if we look for the strengths or look for when somebody's making even incremental progress. And this could be a student who is turning in half their homework, whereas before they didn't turn in any. They might still have more to go, but you want to acknowledge, guess what? You've made a lot of progress here. The reframe I use with my adult patients, let's just say they have gone from being late to work 3 out of 5 days every week, and now they're down to 1 out of 5 days. The boss may still say you have to get here every day, but I'm going, you've just improved like by 200%. You've gone from 3 to 1. And my reframe is, if we invented a medication that did this, we're billionaires. People are lining up outside the pharmacy, but you're focused on the one that you're still not doing. This is important progress, and there may be more work to do. So examples of negative communication, generally in families, name calling, putting each other down, and examples of more constructive ways to communicate. And this is not that we're always perfect, but being able to acknowledge, okay, I know I fell into the habit of calling you this, or I interrupted you, I'll try harder. Even showing that both sides are working harder to change, and especially for parents and teachers and therapists, we can acknowledge our mistakes too. It's good modeling. And giving our students, our children, our teens a chance to voice their opinions and their outlook. Yes, ultimately we may have to set the final rules or the assignments, but sometimes hearing that they have some good ideas or good solutions too, it sets up a more constructive relationship. When it comes to, now we're getting more to some of the negative thinking, the distorted thinking we were talking about. There's some common questions that we can ask to go through, but one, we call them takeaway skill, because it's this stuff always makes sense in the consulting room. And people say, yes, I'm going to do that. Then they walk out and they forget, or what was it you said before and I didn't do it? A useful way to remember challenging negative thoughts is when you catch the negative thought, oh, I'm no good at anything. I got a low grade on my first homework of the semester. This semester is ruined. We frame that, it's like there's this prosecuting attorney making a case against you. And that's what the negative thoughts are. Your Honor, the student has messed up their semester, had a horrible grade on the first homework assignment. They're a lousy student. And then a judgment is rendered on that argument without any other evidence entered into the court. So just the exercise of, if you had an attorney defending you, still bound by the evidence, what argument would that attorney make on your side? Your Honor, yes, did not get a good grade on the homework. However, we underestimated the difficulty of the quiz, did not use the right study skills. There's an opportunity to correct that for the next quiz. For the midterm, it's only 10 points. Not power of positive thinking, but a balanced argument. One, just the exercise of thinking through that argument is an inhibitory intervention. Stop and at least think about. You still have the right of self-determination. You could drop the class, but thinking it through helps even it out more so you can make a more reasoned decision. If a friend of yours was in this situation, would you think the same thing about him or her? What would you say to support that person? We're usually much more forgiving for somebody else, especially if that friend had ADHD. How would you advise him or her? Is there another way to think about the situation? Do I already know what I need to do? What's making me think I can't do that? How bad is the situation really? Is it as bad as if I was in a car accident or something like that? Just to get perspective. In the grand scheme of the universe, why be this worried about it a week from now, a month from now, a year from now? And probably more importantly, what can I do now to manage the situation? So it's about evening out. It doesn't have to be a positive thought. We're looking at an adaptive thought that helps us engage. And there's other tools like a thought record to externalize the information. Because when we're thinking, feeling, doing, and then those feelings affect the thoughts and the thoughts affect the feeling, a lot of the coping skills we'll be talking about later, there's a lot of these sorts of forms because it's how do we organize and compartmentalize different domains of experience so we can manage them better. And that's just an example of one filled out, taken from one of our books. But even for children, you can take a look at just 2 thought bubbles and say, what are you thinking on this side? What's another way to interpret it on that side? And also the power of framing. This comes from work several years ago by a couple of psychologists named Kahneman and Tversky. And Kahneman actually won the Nobel Prize in economics for this line of research. And the only reason Tversky didn't get it is he had already passed away and they're not given posthumously. But one of the early studies on framing was a study of physicians. And they were given a hypothetical medical emergency. And a treatment was framed 2 ways. Either the number of people it would help, a positive, or how many people would not be helped and may even get worse as a result of the same treatment. So the only difference was how it was framed, but it was the exact same treatment. And the physician's endorsement of it differed. There were higher rates of endorsement of this treatment when it was framed in how many people it would help, and lower when it was framed in a negative. Well, here are still all the other people it wouldn't help. So how we present things and think about things. So even, I mentioned before, for my money, the main emotional issue in ADHD is discomfort. Well, discomfort is this an uncompensated loss? I'm going to study for the test and I'm still going to do lousy. Think about a stock investment. I'm going to invest in this company and it's going nowhere. It's going to be bankrupt. Or is this an investment, a short-term cost? I have to handle investment to get started, but usually once I get started, it's not as bad. And I get something done. And then I can earn my Xbox or whatever else comes later that you know logically. But here, some people will say, well, aren't these mental tricks? Absolutely. Yes, they are. That's what executive functions are. But all the negatives are tricks as well that tend to be more damaging. And what are different ways we can